I'm our Frank Gorman, and I want to talk to you again about there are so many problems that orthodox medicine can't cope with. And in this little segment I want to discuss two patients. The first patient with brain failure involving the skin, and the second patient involving brain failure involving the skin of the eyes.
Girl who needs your help. 1 in 3 Australians suffer from eczema. Holly is one of them. Her condition is so bad she scratches herself 24/7. Tonight her parents tell Brady Halls they are desperate for help.
How are you feeling, Holly?
As hard as it is to watch,
Don't do that, Holly, or you'll get carpet burn, sweetheart.
please don't turn away.
We can have a bath now.
Holly needs help.
Why don't you like having a bath?
And you may be able to do just that. Every inch of her body is screaming to be itched. And every day of her 3 tender years has been consumed with scratching.
Yummy ice cream. Yummy ice cream. Now let's go see if our hamburger's ready.
But there are fun times when the itch stops for a short while after Mummy does that hour-long ritual.
How many times a day do you do this?
In probably a 24-hour period, I would do it about 6 times.
Including the middle of the night?
Yep.
Julie lathers Holly in a mixture of prescription drugs and moisturising creams.
What happened on this one, Holly? Were you scratching a bit too much, weren't
That
you?
was from last night, wasn't it?
Was it, darling?
And then dresses her in wet bandages, and that keeps her tiny body cool and moist. She wears these all the time.
Constant creams, constant
yeah.
medication. She even takes antihistamine.
Such is the life of a little eczema sufferer. And this is a good day. This is a bad one.
You're a very brave girl.
You see, this is something that happens pretty much every night.
Eczema never sleeps.
Holly's midnight wake. I think she's been lucky to sleep probably twice in her whole 3 years of living a whole night's sleep.
At times, Tim feels like a helpless father.
This little girl's got it from the top of her head to the tip of her toe, and then when you hear that little itch, imagine that little itch on your whole body, and you can't. And the more you itch it, the more you want to itch, you know. And and you try to, tell a little girl at 3, stop itching, sweetie, stop itching. It doesn't work.
Even the inside of her ears.
Really?
She was actually just bleeding earlier from the inside of her ear.
Holly has been to hospitals, seen specialists, taken every drug and allergy test available. There have been countless natural therapies too, but still, the eczema won't go away.
It's heartbreaking.
I'm doing everything I'm told to do and so much more, yet you can't see it helping, and it's heartbreaking to
So
see.
we've been a dermatologist, and they basically said, you're doing everything you can. Just keep doing what you're doing. We don't have no more answers. And, and I'm just, there's got to be something more than cortisone. You just can't keep putting cortisone on a 3-year-old child day after day after.
Now you've seen that clip, and it shows a little girl very distressed by eczema. And from what the parents tell us, there is no solution which has come to them or which they've achieved in the 3 years that the child has been sick. The reason for that is they're treating the wrong area. They should be treating the brain that runs the skin, not the skin. Now in the next video I'm going to demonstrate that if you treat the brain, the condition resolves without any need to treat the peripheral area. And it will also demonstrate that the important thing to treat in brain illness of this type is migraine in its interictal form.
Treatment for now for 12 months. And Mother, what happened initially before you saw me in the first consultation in Morwell?
Oh, well, we've been to a couple of different eye doctors, and we had an appointment with optician to make him a pair of glasses. He didn't need glasses for his eyesight. There was nothing wrong with his vision. It was just the problem with the eyes that he couldn't see when he got outside and that sort of thing. And we were going to have glasses made that would tint when he went outside, and of course that was Mr. Lowry over in Langatha, and he sort of went a bit mad, and he said, I wouldn't listen to them. He said, it's ridiculous for a 5-year-old to have glasses to go outside. And he then referred me to you, and then we saw you in Mall, and well, then he had his...
Well, yeah, right. And then I said that he had a brain problem and not an eye problem, didn't I?
That's
right. Way to treat it was by manipulation and anesthetic.
Yes.
What happened when you did the manipulation and anesthetic?
Oh, it was just a miraculous change as far as we're concerned. I mean, even that night, on the way home, we went home, it was dark, and he was just sitting up in the car, watching all the other car lights, and we'd never seen them before because he just couldn't stand to look at them. And you know, got home and straight in and sitting there watching the telly as bright as a button, and the next morning he was up, and where it used to take us about an hour and a half to get him out of bed, or to get the head out of the pillow, he just sat up and I can run out ready for school, and he was just a different boy. You know, it was just such a change.
In one night?
In one night, yeah, it was unreal.
And how's he gone on since then?
Usually fairly good, then it sort of just slowly starts to deteriorate. But I mean,
has he been treated since?
Yes, he's had.
Yeah. Why was that? Why did he get treated that second time?
Oh, well, it was starting to get bad again. So we thought, well, you know, we'll try again because it certainly made such an improvement the first time that it you know, couldn't do worse. It had to do better again.
Did he sort of was all right then?
Oh yes, he's been fine for quite a few months.
Yeah.
And then just the last couple of weeks, it's just slowly starting to get bad again. So.
What's bad again? Well, I mean, we can see he's in stress here now.
Yeah, he's, you know, he gets like a discharge in his eyes, and you have to sort of go and bathe his eyes in the morning to then get them apart. He just can't open them, and just can't bear the bright light.
What about you were saying that, you know, it was a bit of a hassle giving you some drops the other day? What was that?
Oh, well, because they were sore.
Yeah, why did you put them in there?
Well, they were very red, and he was sitting like this with a face cloth, you know, and he had to go to school because I have to go to work. And I said, well, there's no one to stay home with, you have to go. I can't send him to school like that. So we thought we'd try some Visine Plus or whatever it is for the allergy eyes. And we just about had to sit on it to get them in.
What would you prefer, getting this sort of treatment once every, say, even 4 or 5 months, which apparently you have to do now, or to do that every morning?
Oh, I'd rather have this done, and it lasts a lot longer.
It's a lot simpler.
Yeah, and it's much easier for him. I mean, he's terrific.
Yeah.
Does
he know that it makes him better?
Oh, yes, yeah. I mean, he's sort of a little bit nervous there before he started. I don't like getting the needle, but I mean, he's been marvellous up there. He knows that Dr. Gorman's going to make his eye better, so he's really happy.
That's good. Now, we had your other boy treated too, because he was restless, I think.
Colin, yeah.
Where's Colin, Mum? No. Colin was interesting because he was wouldn't sleep at night. Can you tell us how he used to walk around?
Oh, he used to get up at 2 and 3 o'clock in the morning, Dad, turn the television on, and he wanted to dance, and you know, breakfast and all this. And I thought, no way. But he'd be up. I mean, the minute the eyes opened, he thought that's time to get up, and up he'd be, the telly would be going, and he just didn't want to go back to bed, you know, and he'd be awake for about an hour and a half, 2 hours.
And that's every night?
Every night.
That must be a bit disturbing for the house.
Yeah, rather.
Yeah, rather, right. And then since the treatment, he's had a treatment too, hasn't he?
Yes, he's had one treatment.
The 2 things have happened since then. The sleeping is... The sleeping is...
Yes, he sleeps all night, and he was getting quite a large number of nosebleeds, which he doesn't have now.
Yeah, the cure of nose bleeding by spinal manipulation is really quite ridiculous, but what must be is the blood vessels are dilated in a funny sort of way, and that when you make the whole system better, the blood vessels aren't dilated and they don't burst, and then you don't get the nose bleeding. Okay, so what we'll start with this tape now, and we'll keep it for him, and then we'll follow him through and see what, because he's a really very instructive tape. You can see how the stressed Michael is at the moment. You know, he's rocking and he's
Now, having seen those two videos, you can see that in one case there was no result, there was no good result from the treatment. In the second case, the result was very satisfactory. Now, the thing is that the second case treated the skin of the eyes in the brain, whereas this first case treated the skin of the body on the body. The more fundamental approach is to go for the root cause, the problem in the brain, and if you treat that effectively, the problem in the body will just fade away.